My name is Dr. Rastamova. I am a gynecologist who performs also halo testing in my office during annual exams on my patients.
Why do you recommend halo exam?
Halo exam is the screening test for breast cancer prevention. Having that test abnormal doesn't necessarily mean that you have cancer, but it helps us to see what is the risk of this particular patient to have a cancer. And we know that cancer doesn't happen overnight. There are certain changes that cells go through before they turn into cancer cells. And those changes we're able to recognize way before. And by doing so, we extract that high-risk population from general population, watch them closely. And the chances that if this patient is being watched under the microscope, the chances that she will develop breast cancer is pretty low. So that's the purpose of halo testing. Because the principle of the halo testing is to extract cells, fluid, anything that inside a duct. Mammography is to recognize when the lesion is already there. Halo testing is to see what is brewing in that area that may turn into cancer 5 years, 10 years from now. So it is completely different things. But if patient had abnormal mammogram, if patient had some kind of mass, halo could be helping to determine whether this mass is malignant or premalignant by showing some abnormal cells. Another word for halo test is a pap smear of the breast. We know that pap smear is, it was invented by Dr. Papanicolaou to recognize the changes, the certain changes on the cervical surface and cervical canal. And we had cervical cancer used to be #1 GYN killer in the world and United States 10 years ago. Now it became #9 killer in the United States, still #1 killer in the world. But why it happened? Because we recognized those changes. Same analogy to halo testing. We can recognize that, and if patient had certain changes, she may be either just watched or she will have a treatment. And if patient had abnormal halo testing, instead of being watched by a regular primary care doctor or GYN doctor, she will be put, like I said, in a high-risk group, and she will be watched by breast specialists. Halo testing been here for several years, but was approved by FDA only 2 or 3 years ago. And another reason for being halo not so popular, because it's not fully covered by insurance. And that's another reason for patients not to have it, in case if they don't recognize how important it is to have a halo done. And for the physician is also not easy, because physician's responsibility to buy machine, physician's responsibility to buy supplies, and not all the doctors can afford that, especially if it's not covered by insurance. Yes, I do have patients with breast implants, and some of them, like I said, if patient had breast implant without areola involvement behind the muscle, they good candidate for halo.